Now,
Yes. Now it's coming. Anatomy of the lower face. I
yeah,
can see that.
I think I need to record first and then it starts. I don't know, something.
Yeah.
So, anatomy of the lower face. So, in the lower face, when we talk about the aging, first we have to understand the aging. What are the constituents of the lower face that are undergoing aging? First is the lips, chin, and jawline. The major muscle which is contributing to the aging is the mandibular, changes in the mandibular region and changes in the muscle of the orbicularis oris. These are the two major changes which are contributing, these are the two major factors which are contributing to changes related to aging in the lower face. Now, the lower face changes usually they happen to appear after the mid face changes have occurred, you know. So first the mid face changes, like in 30s to 40s, you see mid face changes, and in late 40s and early 50s, you see lower face changes usually. So mandible is a major important bone which contributes to the all the changes, most of the changes in the lower face. Now the muscles, what is happening to the muscles is the muscles are losing their tone and elasticity. So all the muscles, smile muscles, laugh muscles, all the muscles are losing tone and elasticity. And the muscles like mentalis and DAO and DLI, they are becoming more active. Even the platysma is becoming more active. So everything like the mid face muscles or the smile muscles are becoming losing their tone. And on the other hand, because of the bone changes in the mandible, the muscles related to this area in the mandibular area, they are becoming hypertonic. So the end result is that everything is getting pulled down. Because why the lower face muscles are becoming hypertonic? Because there is bone recession. So because of this bone recession, the muscles are not able to perform as before. As a result of which, to compensate the the lost tone, they become hypertonic. Right? Is
So
that
why do the depressors become hyperactive, not the other muscles? Why
uh,
only the
because
depressors are becoming?
because depressors are basically, the gravity is giving an additive effect,
Oh,
right? And we are not stopping to, see, when you smile later, like in youth, the smile is having an upward turn, whereas when it comes to the senior age, the smile becomes first horizontal and then there is downward turn,
mhm.
right? And the mandibular changes are much more as compared to changes in the zygomatic bone. The speed at which the changes happen in the mandibular region are more
Okay.
as compared to the zygomatic. And in maxilla, there is only maxillary recession.
Yeah.
So, the muscles are becoming hypertonic. Same way, even frontalis becomes hypertonic because,
Yeah.
you're trying to compensate for the uh, drooping.
Okay.
So the eye frontalis and this muscle becomes hypertonic, as a result of which at rest also the eyebrows are lifted only.
Okay. Yeah.
So
Yeah.
similarly, DAO, DLI, and the mentalis muscles and the platysma, they pull everything down. Now it could be relative also, relative in the sense that the opposite muscles having opposite actions are losing tonicity, which might
Okay.
contribute to the overactivity of the underlying muscles.
Yeah.
So that is why when you say that you have to inject Botox and Mentalis and DAO, they are very minimal quantities, not much. 2 units, 4 units maximum, nothing.
Okay. Yeah. So in when we inject Botox, we are to be sure that we are not injecting in depressor labia inferior. We are just injecting in DAO. Is it
Yeah,
like that?
yes.
Or we can inject in depressor labia inferior
No, no,
also
no, no
Botox?
DLI. No
No,
DLI. Only
no
DAO.
DLI
Only DAO and Mentalis.
and Mentalis. So we should not inject in depressor labia inferior.
No, no, no. It's not required. So retaining ligaments which anchor and stabilize the skin and fascia. So in the lower face, we have the mandibular septum, the mesenteric cutaneous ligament, and the platysmo-auricular ligament, and mandibular cutaneous ligament. These are the 4 ligaments which are important when it comes to the lower face. So when when we talk about aging in the lower face, the subcutaneous, at the level of the subcutaneous fat or facial fat pads, the nasolabial compartment is also coming down. The medial cheek compartment is falling down, and the middle cheek compartment is also coming down onto the lower face, which is why they say that mid face changes precede the lower face changes.
Yeah. Can I see the diagram for the ligaments again, once again? Okay, this is the mandibular septum that's down.
Yeah, mandibular septum, then mandibular cutaneous ligament.
So the jowls are because of mandibular septum problem? The
No,
jowls.
how is the jowl? The components of jowling are, first of all, there is mandibular recession, loss of loss of the bony support. As a result of
Yeah.
which, there is a vacuum created, and in that vacuum, uh, the overlying fat which is coming down is occupying that space. Now, when
Okay.
it's coming down, it is limited by in its movement by the mandibular cutaneous ligament. It cannot move beyond that.
Yeah.
Right. Now the jaw, because the mandibular is also mandibular recession, the definition, the jawline also loses support. So the overlying soft tissue loses bony support, and then it falls forward. And then again, it is limited by mandibular cutaneous ligament. So all these contribute. So first is the mandibular changes, and then the falling forward and limitation to the forward fall to the overlying soft tissue is contributing to the formation of jowls.
Okay, just like nasolabial fold is there that prevents the forward, the medial descent.
So there, in the
So mandibular
nasolabial
cutaneous
fold,
is also preventing the
yes,
medial descent.
exactly.
So what's the role of mandibular septum? Where does the mandibular septum become important clinically for us?
Mandibular septum becomes important because this is covering the mandible, entire mandible. So whenever you inject over the mandible, if you inject over here, the entire area will come up, because this whole muscular sheath is covering this area. Sorry, fibrous sheath is covering this area. Fascia is covering this
So
area.
we have to support mandibular septum also
Yes, that is the main
with
thing.
our fillets so that it lifts the jowls up.
Yeah. So if suppose we are doing jawline definition, so the first step in jawline definition is lifting of the overlying structures, lifting of the cheek, lifting of the, JW1 and the, preauricular filling also, because all these contribute to the lifting effect.
Yeah.
And then you you compensate for the mandibular recession by injecting on the bone in the pre-jowl sulcus.
So is that working on the mandibular septum or is it
Yes,
working on
mandibular
mandibular
septum.
cutaneous?
It is giving support to the mandibular cutaneous ligament.
Or giving support to mandibular cutaneous ligament?
And yeah, the ligament.
Okay. And where does a mesenteric cutaneous ligament become important from point of fillers?
No,
Or
it,
that has
it
no role?
doesn't. It doesn't. Just the JW1, not very important. But mesenteric cutaneous ligaments is that in elderly, you see a small line. The lower cheek is divided by a line. A line develops, a groove develops.
Groove.
Yeah.
Below at the level of the lips.
No. Here,
Ah.
this. The
Okay, like
masseter
that.
becomes separate from the buccal fat.
Okay, a vertical line comes.
Yes, a vertical line comes. So that is, the line is because of the mesenteric cutaneous ligaments.
Okay, a vertical line comes. That's the significance of this
Yes,
mesenteric cutaneous ligament.
this leads to development of that demarcating line between the
So it is separating the buccal fat from the
mesenteric ligament.
medial.
Masseter muscle.
Okay, yeah. Mhm. Fine, got it. Thank you. Yeah.
Okay.
Yeah, this is clear. Yeah.
This is facial artery. Like facial artery, we all know that you clench you clench the muscle, clench the teeth, mark out the anterior border of mandible, and just forward to it, you can feel the facial artery over the bone. That is where it is entering the face. Then it is, having a, curvy linear path, and obliquely forwards and upwards, it rises, goes to the modulus. At the modulus, they say there's a point, there's some region where the artery is, naked. There are no overlying structures over that artery. There is one point, near the modulus.
Yeah.
And then it becomes more superficial and moves upwards and forwards obliquely towards the lateral nasal ala, becomes the angular artery.
So it is deep till modulus. It is deep till modulus. After modulus, it starts becoming superficial.
Superficial, yes.
And the more it comes medially, the more it becomes superficial. And the angular artery is like quite superficial and
quite
even
superficial, yes. So it is
Yeah.
also giving, now it has a tortuous course because this lower jaw is a mobile structure. It's hypermobile structure. We talking, eating, everything we are moving. That is why it is tortuous. So the tortuosity contributes to the movement of the lower
Yeah.
jaw. Then it is giving inferior labial artery, superior labial artery before it becomes the angular artery.
Yeah.
So this is like. So lower principles that attractive youthful faces, they are oval in shape, and later on they become square, like because of sagging and forward fall of all the structures. The shape becomes square shape. This we have done, I think. Now the angle of the mandible, because of the jaw recession, because the jaw mandibular recession, the angle of the mandible becomes wide. It widens from an L. It becomes I kind of a thing.
From L to I, what does it mean?
Like this is L. And I is almost like this. So this point, this defining point, this becomes blunt. This blunts out.
Oh, that means um, that it is shifting backward. The mandible is shifting backward.
So when it comes to mandible, the mandible rotates inferiorly and backwards in women.
Okay, backward.
And in men, it undergoes forward rotation. So the changes in men and women are different when it comes to mandible. This becomes important when we inject chin. Because in women, the chin loses its projection with age, and in men, it becomes more prominent with age. Projection. But now when we talk about the angle of the mandible, that is becomes, this is a L shape and it becomes more or less I. So this angle is lost. This angulation is lost.
That means it become more oblique.
Yeah, yes.
Okay. The angle becomes more oblique.
Yeah. So this is, they say, the angle at the intersection of the lines. Like we have to draw oblique line from the lateral aspect of the cheek, draw a vertical line, the angle of the mandible, it has to be 12 degree. But this is like, more of theory while injecting. I don't think anybody does that. Just for, theoretical, if you want to just see, you can do 1 or 2 patients like this. Another thing which I don't know whether I mentioned, there's a line of ligament. Did I tell you about the line of ligament?
No.
So this is the line of the ligament, this in line with the lateral canthus, and this is called the line of the ligament. Anything injected lateral to this line will have a lifting effect. It will lift the underlying structures. Whereas anything injected medial to it will have a filling effect.
Okay.
And all the important ligaments like ORL, ZCL, mesenteric MCL, they all lie in this line. That is why it is called as the line of ligament.
Yeah.
So is that clear? Shall I continue?
Yeah. Yeah. Clear. Yeah. Yes. Right.
So the jawline and chin, see, this is like the L shape. This is L, it becomes more of I. So this angle, we've lost the angulation. So sharp demarcating line between lower face to the neck, a horizontal and vertical outline connected by a sharp or gentle curve at the angle, and a gentle silhouette just below jaw onto the neck. So this is the ideal jawline. And a continuous
Yeah.
unbroken line from the mandibular angle to the chin. See this, this is blunted out. This is almost an eye.
Yeah. Got it. That angle is lost.
Yeah, we have lost the angle. Now, facial shape, now chin plays important role in defining the shape of the face. It should shape resembling the tapered end of an egg, and the tapered end should lie within the oval. So it is a 3D structure with adequate anterior and inferior projection, right? So the moment you start working on the chin, you can actually, work on the entire facial shape.
Yeah.
So this is like a Hinder's line and all that. This is for lips. Now, in men, the chin is mostly not an oval, but a box-like lower jaw.
Yeah.
But they're in like Japanese or South Korean, even men have, feminine faces, but it is like their, uh, you know, uh, feminized male is also considered attractive in some cultures. Like if you see Japanese faces or South Korean faces in men, they have certain
Yeah.
features which are, women like, which uh, are. So these, I said these slides are made as per Caucasian faces.
Yeah.
So study of female perception of masculinized and feminized male face images found that men with feminized faces are more likely to be good husband. Oh, this is like, this is just a
Yeah.
thing for theory.
Less aggressive.
Yeah, less
They are
aggressive.
less aggressive.
Yeah.
Yeah.
So effects of aging on the lower face, the central and lateral face lose fat with age. The mid-lateral band of the face accumulates fat, and loss of volume leads to gravitational descent of the face. So this is what we told, like if we divide it into middle thirds, so the mid face is losing volume and the lower face is gaining volume over time.
Yeah.
The drooping appearance of the perioral area is a characteristic sign of aging. Now here, the perioral region, I'm just telling from my notes actually. Yeah. So the perioral region, what happens? It loses definition, fullness, and shape. The lips become flat and they retrude. The vermilion border, the cupid bone, they become less pronounced. Cupid peaks, they fall. I mean, they become wide, they widen distance between the cupid peaks and it becomes less pronounced. Perioral wrinkles and folds will form. So all these changes are because of the changes in the orbicularis oris muscle, which is the most important factor affecting the lower area. So the muscle, what is happening? The orbicularis oris muscle is losing its tone and elasticity. And secondly, the underlying support to this muscle is also gone. So as a result of it,
Yeah.
the above changes are happening. So there is mandibular recession. There are changes in the muscle support, and then there is overactivity of the depressor muscles. So all these,
Yeah.
so the DAO is pulling the commissures down, volume loss,
Yeah.
and the resultant downward movement of midfacial fat, which becomes heavy. Now, most of the procedures like HIFU and all, they say they work on the lower face and help in, reduction of fat. But I don't know, you can do that also. But first is always lifting, and then, if the face,
Yeah.
depending upon the priority. Because usually they say
Yeah.
like as it is volume loss is happening now, HIFU will contribute to even more further volume loss in the face. So that is going to make, so when I get my masseter done, I develop pre-jowl sulcus. My pre-jowl sulcus becomes deep because the muscular support which is holding the tissues, soft tissues, overlying soft tissues is gone and they fall forward. So after getting masseter done, my jowls become more prominent.
Okay. Yeah. So whenever you're doing masseters, which we do in females, what we should be doing to prevent this jowls coming more strongly?
First thing
Should
is
we put some
notice the
filler?
skin. No, first thing is you should notice whether the skin good skin tone. Secondly, see whether some amount is there some degree of jowling present. If there is some degree of
Yes.
jowling present, then the degree of jowling will increase. And thirdly, you can tell them that if this becomes, then you might have to get a filler done. Tell them before itself.
Okay.
Face will become
Got
slim,
it.
no problem. But here you
Yeah.
might need a little bit of filler.
Yes, got it. That's a good point. I think we should be aware of it.
Hmm.
Um, yeah, and my thing, this is not related to filler or Botox, but as the muscles are becoming tone, they're losing their tone. Is there any role of microcurrents? I don't know. It is not. We never talk about microcurrents in our practice, but you know,
They have
off-counter people buy microcurrents. What have you ever tried microcurrents, or do you ever prescribe
microcurrents were
microcurrents?
like 20 years back when we had some facials in VLCC. They were microcurrents. So microcurrent treatment is good for initial changes, first of all, like in your 30s.
Yeah.
Secondly, they are not a corrective. Botox fillers and all, they are corrective modalities. Microcurrent is a preventive modality, basically.
Does it work on muscles?
Yeah,
Microcurrents?
that's like the muscles in the dermis area. No, sorry, epidermal. Dermal muscle,
Not
I
on the
don't think
muscles.
that goes. No, I don't think so. Only HIFU is something which can, reach to that depth. Smash and all.
Okay. So we don't have anything to work on muscles like that.
No, no.
Nothing to work
When
on
you say
muscles.
that
Nothing to
yoga
balance.
and muscle exercises and all, you do,
Yeah.
obviously, when you do that, first of all, they have to be done repeatedly. Like every day for half an hour, you have to work out your muscles. And secondly, it has to be done every day. And thirdly, when you do more of muscle movement, the skin is getting compromised. You are, contributing to the formation of or deepening of the, superficial wrinkles and fine lines.
So it's not really effective.
You have to weigh, sometimes. For some people, depending upon the anatomical changes,
Yeah.
you need to,
Okay.
design a plan. Because in some individuals, fat changes are more, in some individual bone changes are more. So when I've seen, like, while injecting cheek, you can gauge whether there is a bone resorption or, osteoporosis in women. Because in women, what happens if there is there is calcium or, vitamin D deficiency, bone resorption is going to be more. And the bone, when you hit the bone, it's very soft. The needle is just you have to hold the needle for not getting inside the bone, something like that. You can
Yeah.
feel the porosity of the bone actually with the needle.
Yeah.
So
Yeah.
in some individuals, if I feel something like that, I check their vitamin D and calcium levels checked, and it's most of the times it is low.
Yeah. Okay. Got it.
So, now jowls develop when the jawline loses its firmness. So firmness is lost because of the first is the loss of the bony volume in chin and jaw, superior and lateral forward folding due to changes of jaw angle and malar descent of the malar tissues, weakening of the retaining ligaments, that is mandibular septum. Now this weakening is also because of the loss of bony support. As such, ligaments do not age and do not weaken. There's loss of skin tone, there's sagging of skin and subcutaneous fat. The jowls make the lower face appear wider. Platysma.
Just
Yeah.
go to the back slide. The second point, the superior and lateral forward folding.
Superior
What do you
and
mean
lateral
superior
folding due to
lateral
changes of
forward
jaw and
folding due to
changes
changes
of
of jaw
jaw
angle?
angle and malar
So
tissue.
malar would cause downward descent. I can understand. How will it cause superior and lateral?
This means that structures lying superior to it
Yeah.
and structures
Okay.
lying
And
lateral
lateral to it.
are forming.
Yeah. Lateral forward folding means the structure that are lateral, they come forward, the superior,
Forward.
they come downward. Is
Yes.
it right?
Yes.
So superior structures are coming downward, the lateral structures are coming forward.
Exactly.
Because the jaw angle is getting resolved, getting
Yes.
absorbed, and it is losing its firmness.
Yes.
So
yes.
basically, when it is coming
This
for
is
the
the bony
jaw,
support. These are the soft tissues. Bony support is receding, soft tissue going down.
yeah, from superior it coming down, lateral it is coming forward.
Yes.
Lateral, from the lateral side is coming forward.
Yes.
Okay, okay. God, yeah, that's right.
The platysma pulls the lower face down by depressing the mass and depresses the lower lip also. So platysma plays a very important role in the forward pull to the oral commissures and to an extent to the jawline muscles also.
Yes.
So the tapered lower face becomes more square. Laxity of soft tissues and atrophy of bone leads to blunting of the jawline. Pre-jowl circle creates an indentation between chin and jawline.
Yes.
So a dimpled chin with an orange peel effect results from loss of collagen because of the skin changes and repeated lifting of the chin by the mentalis muscle. And mental
Okay.
creases and deep crescent shaped grooves between the bottom of the mouth and point of the chin. So this also develops. This is a volume loss. Mandibular recession. There is recession of mandibular bone, and which creates a hollow or vacuum over the this area, and this leads to this is not actually volume loss, but it gives the illusion of volume loss.
Yeah, the mental crease forms. So
Yeah.
what does form the marionette lines?
Marionette lines
Is it a
formed.
ligament?
No, it is not a ligament. Again, it is because of the the fat pad. I don't know what they call it. Loss of this fat pad and mandibular recession. Two components.
The marionette lines.
Yeah, marionette lines.
Just like nasolabial doesn't have any ligament, so marionette
Yes.
also doesn't have any
Does
ligament.
not have any ligament, and the DAO is contributing to the downward turn of the oral commissures. So the DAO downward turn of the oral commission and marionette line, they become most of the time one entity only.
Okay. Fine. And there is no ligament in it. And the mental crease also doesn't have any ligament.
Yeah,
It is just a groove that forms.
Yeah, it is a groove
So,
because repeated first the mentalis is receding backwards, the overlying tissue, and the muscle is becoming hyperactive.
yeah, muscle is becoming higher. Okay, fine.
So when we come to the lips, I think this session is going to get over. So this we can take lips we can take, but still a few things we can discuss. Well-defined and
Yeah.
full lips represent attractiveness and femininity. The lips are the most important aesthetic structure in the lower third of the face, and full lips of optimal shape and proportion impart sensuality in all the races. There are some differences between the Middle Eastern, Caucasian, South American, and Asian lips. So Asian versus Caucasian, in Caucasians, the lips are thinner, especially the upper lip. Whereas in Asians, the upper lip is thicker. Upper lip is more prominent, it's more pouty. That's a genetic variation.
Yeah.
And in Caucasians, the lips are wider. And in Asians, the lips are width is shorter.
Okay. Yeah.
So these are the golden ratio of the lips. This we can discuss when we, start the next class. When do you want to have the next class?
Yeah. Can we have it tomorrow?
Okay.
Because